Hey everybody, I'm here with Dr. Yuriy Dobry and Mr. Eugene Tilman at LGTC Group. You can find them at lgtcgroup.com. So we're here to talk about their treatments for mental health and the success they've been having with patients there. So thank you guys so much for joining us today. I really appreciate it.
Thank you. It's a pleasure. Yeah.
Thanks for having us.
And I wanted to start off just by asking how long you had been working in the space with, patients and their mental health, and as I understand, kind of a comprehensive approach for patients there.
Right. Excluding my fellowship and residency, I've been doing this for about 13 years or so. So it's quite some time, right? Quite a while.
Is there anything in particular that really drew you towards that field initially?
Well, my father was a psychiatrist. That was his sort of, he spent his whole life in the field, essentially. And then, so that obviously had an impact on me. And then I also did a lot of research in college and after college in neuroscience. And it all kind of, it all kind of came together at the end of medical school. And here I am.
Yeah, that's great to hear. Yeah, it's a very fascinating field. And I think we're at a time right now where it's just constantly expanding. We're learning more and more about what can be done.
Absolutely. Absolutely.
And what are the most common mental health concerns that you've seen an increase over the last couple of years with everything that's been going on?
Yeah, I mean, since COVID, basically just psychopathology across the the entire spectrum has kind of spiked, but specifically mood and anxiety disorders have really been reaching sort of new heights. And we're seeing a lot of patients with depression, with worsening of depression or new onset depression, as well as anxiety. Yeah, absolutely.
Yeah, and what are some things that the patients can do on their own to just help, keep as much of a healthy mental state as possible?
Well, obviously, besides sort of, healthy lifestyle, behaviors, exercise. Diet, trying to establish like a healthy work-life balance, right? It's also important to just be mindful that if things are not, if they don't feel right, if something is not going well, then, basically trying to get kind of care as soon as possible, accessing care. I think that's a big thing that, is often missing.
A lot of undiagnosed situations, acknowledging the issue and having resources to get help. It is important.
Definitely.
Identifying and treating the problem.
Yeah.
Yeah, and I think thankfully a lot of us have, started to realize that, taking care of our mental health is something that, there's no shame in. It's a lot like taking care of our physical health.
Absolutely.
And yeah, we just need to start.
And so being mindful of that and sort of, taking action in a timely way, I think is a very important piece of it.
Yeah, absolutely. And for those patients that do need, more of the interventional approach for things, what are some of the treatments that you offer there at your practice?
So, I mean, we offer, our practice is really sort of, in some ways, I would like to think is unique because we offer, almost every service, every psychiatric mental health service. So, we offer sort of conventional approaches such as medication management, right? We also offer things like TMS, ketamine. We offer a variety of psychotherapy modalities. We have, different ways in which we, kind of dispense psychotherapy. We have intensive outpatient programs here. We have partial hospitalization program. We have eating disorders programs as well. So we're able to basically, offer almost every service within mental health care.
Psychodiagnostic evaluations,
neuropsychological testing. That's right. I forgot about that. So we're basically in some ways we're sort of autonomous in that sense. We can be autonomous.
The goal is to offer end-to-end mental health care. That and I started this since 2015, and it was always sad to see someone needed something else and not having it. And so we've been slowly naturally kind of shaping the organization to meet the need of the community. And,
I worked at several places prior to, joining Eugene at Los Gatos Therapy Center. And one of the biggest issues for patients was this whole fragmentation of care, right? I mean, people would have to go between different institutions, clinics, to receive services. And I think the fact that we're able to kind of offer basically, well, we can address most of their needs here is a huge, it's a huge advantage.
Yeah, absolutely. I think that makes patients feel like they're a lot more cared for. They don't feel like they're just
thrown around in the system, kind of.
Yeah, absolutely. And for patients that might not know how TMS works, can you explain how you would typically treat somebody with that?
So, let's start with, with FDA, TMS is, cleared by FDA, right? And it's recommended for treatment-resistant depression, which is basically, a patient who has failed for some reason, right? Two medications, two antidepressants, right? Either they couldn't tolerate the side effects or it was just not effective, right, for their depression. TMS is then recommended by the government, by the FDA. So, this is basically, approach of sort of the treatment that I provide, specifically I provide in the clinic, right? So majority of my patients do have treatment-resistant conditions, whether it's the, anxiety, depression, OCD, meaning they have failed or they, they've tried multiple medications without much success. And so, basically what I do is I start layering these other modalities, right? Potentially on top of or instead of medications, right? Such as, transcranial magnetic stimulation. Ketamine is another sort of treatment approach that we have here that I sometimes combine or sometimes just, use on its own with a patient who's had less than favorable experience with antidepressants, for example, or just psychiatric medications in general.
Yeah, that's great to hear. So sometimes if, it's appropriate for the patient, you'll combine those two therapies.
Absolutely. Yeah. I mean, it depends, again, it depends on patient's past psychiatric history, right? Meaning previous treatment experience, et cetera, their family history. It could be, just used on its own, or it could be combined. And as long as we're getting the right results for the patient.
Yeah, definitely makes sense.
Yeah.
And so typically, is there an ability for insurance to cover those treatments?
Our clinic functions. We take every insurance.
We accept all the access to care is our top priority. We are contracted in network with all insurance plans.
So every one of my patients, every one of our patients, period. We take their insurance and we work with the insurances essentially. Yeah.
And TMS is well covered.
And TMS is covered as well as ketamine. We're able to offer care to anyone who's interested in in our approach in working with us.
That's great to hear. And so for patients that, come in and they do TMS or ketamine, how many sessions are you typically finding that they need? And I know it's going to vary if you do them in conjunction with each other.
So each treatment modality has its own kind of schedule, right? Has its own treatment course. So TMS, typically you start with 35 sessions. You might add more sessions at the end if you feel like the patient is has gotten better, but hasn't necessarily gotten to a point that I'd want to, we would basically has not yet reached their goal 100%. And sort of course, the duration of the treatment depends on the frequency, right? Of how often does the patient get it per week. Typically, you don't want to basically do less than 3 sessions per week. So, majority of our patients are here, basically are here 5 times a week for TMS. And then ketamine has its own treatment course. It lasts 12 weeks. It consists of 14 treatments essentially. So if we combine the 2 treatments, we just put together a schedule for the patient that's acceptable to them and that would work clinically as well.
Yeah, that makes sense. And so if a patient, finds relief from those treatments and then, let's say down the line, a year or 2 later, maybe starts having some symptoms come back, are they a good candidate to come back in and maybe have maintenance treatments?
Absolutely. A good percentage of my patients don't have to come back, as a matter of fact. So their improvement is clearly, has taken a more permanent sort of form. But there are patients who do feel like, some things need to be kind of like, corrected again, and they come in for repeat treatment.
Yeah, it's
But usually after they go through TMS or TMS plus ketamine, they're able to stay either symptom-free or significantly improve for usually at least a year or so.
kidding.
Statistically, some people, some people completely, improve, but a lot of people will just get some improvement and get much better results with like a single medication.
Yeah.
But the advantage of TMS treatment is that they come here and it's a 20 to 30-minute procedure, and there's absolutely no side effect or effect of any kind. They just walk out and
it's trivial side effects, if any. And more than 30% of patients who go through TMS are able to either lower their meds or stop medications altogether. So that's something else that people, to keep in mind.
And if somebody has achieved, substantial reduction in symptoms and lower the meds, they can repeat the course, and it will be better. Doctor, I think, always weighs the pros and cons of the medication and their side effects. Was having something that, is according to the manufacturer, the TMS is no more harmful than flying in an airplane.
Yeah. So imagine someone with, who's been accumulating medications because nothing is working. They're coming on 5 medications. They go through a treatment course and they're able to lower it to like 1 or 2 medications. I mean, that alone carries a huge benefit.
Definitely. Yeah. And I was going to ask about that with the side effects and everything, because I know that's a huge thing for a lot of patients is, they, even if they feel like the medication maybe works for them, they feel like the side effects aren't worth.
Side effects. And also as you go up in a number of medications, there's also just risk of adverse events. I mean, besides side effects, right? So you're lowering the risk of like some kind of like cardiac problem, like heart issues, right? Just blood pressure elevation, hypertension, et cetera, right? But side effects it's a common problem. I mean, side effects is the reason that people do kind of enter the category of treatment-resistant depression. They're unable to tolerate these medications.
Right. Yeah, that makes sense. And are the results that you're seeing with TMS and ketamine similar to the ones with medication, or are they better?
I would say that they're higher, but meaning they're better actually. So on the average, right? So I've done TMS for a long time, right? I've been doing TMS for a long time. I've probably, I've tried to calculate recently. I probably have done around 600 cases in total. I mean, which is quite a lot. And I would say around 70% of patients who go through TMS, again, TMS plus ketamine potentially, right? They either have a significant reduction or near resolution of their symptoms. So you don't see the same kind of, and that's without really side effects, right? I mean, we're talking about something very minor, if anything, right? And you don't really see the same results with medications. So, but also don't forget, some patients actually, it's the most beneficial route, the most beneficial approach is to actually combine medication with TMS and ketamine. I mean, it's really customized treatment for each person.
Yeah, makes sense. And so if a patient comes in and they're already on, like you mentioned, 4 or 5 medications, maybe just have them continue and then slowly see if you can. Slowly
see how they're doing, and in response to their progress, start potentially tapering, getting them off one medication after another, without compromising this newfound stability or improvement that they've made.
And is there anybody that's, specifically not a good candidate for ketamine or TMS?
Well, it's not that, it's not about not a good candidate, but there are, people, for example, who have epilepsy or have had a lot of previous seizures, right? They can still be candidates, but, I often require them to get like a clearance from a neurologist. Someone who does have a history of seizures, TMS can potentially.
Somebody with a pacemaker.
That's right.
People that have metal in the.
But most pacemakers nowadays are safe for magnetic intervention.
Well, I guess if you have like metal in your head, traumatic head injury, like all these things are definitely something.
But they're not absolute contraindication. Right. Meaning, it's something. Eugene is right. It's something to kind of take into account, explore, possibly get clearance from another provider. But ultimately, you can still, use these interventions. Majority of them.
And I think that the label for TMS is major depressive disorder, right? So like if people have bipolar and OCD.
Yeah.
So there's certain conditions that,
But to be quite honest, anxiety also responds pretty well.
Yeah.
So it's the use is broader than just what FDA.
Well, in Israel, it's used for insomnia and PTSD and anxiety. Like they have a label for it. It's just here they're waiting for the label.
Yeah.
But there's much more adopted use of the technology.
And these things are being explored here, and I'm seeing like alternative protocols kind of emerge over time. We're just waiting for more data on some of them.
Yeah. Yeah. Do you think in the future that the FDA will catch up with some of those and start?
The number of papers that are being published on TMS and outside of depression is growing daily. So meaning that there's more and more data accumulating, and that means that FDA will take notice.
Yeah, it's good to hear.
Yeah.
And if a patient is already doing, talk therapy and things like that, and they start doing those treatments, do they typically start responding better to their?
Absolutely. In my experience, yeah. And that is why, one of the reasons why we, whenever I see a new patient, I often recommend that they engage in parallel to all of these medical treatments, they engage in psychotherapy, which we're also able to basically provide to them here at the Let's Garas Therapy Center. So we have a large team of therapists who function as individual therapists or group therapists, or as a more like intensive outpatient program psychotherapy. And I often prescribe like sort of parallel treatments, so simultaneous psychotherapy with TMS or with ketamine.
Yeah, it's good to hear. Yeah, and so if a patient, is going to maybe have somewhat of a breakthrough with the TMS or the ketamine, then you can have them engage with the
Absolutely. Oftentimes when someone is in a really kind of like dire situation, right, symptoms-wise, they're unable to engage in psychotherapy. When you kind of start, these things in simultaneously, they often do better in both treatments almost. It's they're sort of, they kind of work together essentially. They're complementary of each other.
Yeah, that's great to hear. I'd imagine that's really encouraging for those patients.
Absolutely.
The ketamine, they have labeled, the FDA approved it on its own to major depression. However, Dr. Dobry have mentioned that the best results are achieved when there's a ketamine-assisted psychotherapy, but that is not like technically a part of the treatment. We try to make it as much as possible. It requires separate training, but
our psychotherapists are trained specifically in ketamine-assisted psychotherapy. We had seminars, etc., so they're able to provide that.
Mm-hmm.
Although, like Eugene said, it's not like it can be done on its own. It's just in my experience, the best results come from synergism of all these modalities.
Yeah, it makes sense. Yeah, and I think for those patients too, that like we were talking about at the beginning, you can try to implement good healthy habits as far as meditation and things like that. But I think for a lot of these patients, that can be somewhat of a really daunting task for them. So it's great to hear that they can make a breakthrough. And
also remember, we're able to provide all these modalities in a kind of like organized fashion, right? As a one treatment approach here at this clinic, at our clinic, which is where I need to run between different locations and.
But it's most effective when they're engaged and where medication, TMS, and ketamine sort of lift that veil, that darkness, to give them an ability to then talk through their issues and create some kind of positive,
and they feel comfortable being at our clinic. We're all their providers are within one space.
Yeah, that's awesome. And like you mentioned at the beginning, it's important for patients to reach out and get help, as soon as possible. What are some signs they can look out for if they're trying to determine if they should reach out?
So what I tell my patients, right? How do you sort of, how do you gauge your mental health, your emotional state, right? So there are really two things, and they're sort of codependent on each other, but you can separate them as well. So there's, just subjective symptoms, right? Like how you're feeling every day. But also there's a issue of functioning. Are you able to function as well as you were before, or as sort of age expected functioning, right? So to speak. So, I ask a patient whether or not are they having a harder time waking up in the mornings? Are they missing their work more? Are they unable to, are they just lower? And I mean, so again, both subjective experience of your well-being and your ability to function, like carry out your life.
Yeah, I think that is a great way to gauge the mental health and understand that. And then for, friends and family of those patients too, if they start seeing a decline in that of those patients.
Absolutely. That's why we like to integrate, we include family and just, close people, friends in person's treatment if that's appropriate,
Yeah, and although our organization is, so we do have a lot of services for teens.
That's right.
Even though TMS is for 18, approved for 18 and over, we did get some success with getting it to 17 or 16-year-olds for covered by
And
insurance.
they benefited just as much as someone. I mean, as you can imagine, the difference between a 17 and an 18-year-old is really.
But we do have a lot of services for teens. We have child psychiatrists.
That's right. I forgot to mention, we're not only at Los Gatos Therapy Center, we see every age group. Including geriatric patients, so older patients as well.
But the parents are involved usually, and the caregivers are involved with geriatrics. But the parents are, fairly important when you work with teens. They're gonna see the signs whether the people are failing at school. It's usually like a behavioral signs that.
That's right. That's a perfect example of functioning.
Yeah.
So someone is doing well their whole life academically. All of a sudden, they're just getting worse grades. They're getting calls from the school that they're missing. So something is not working anymore. And so that's a perfect example of how you gauge someone's mental health.
And then during COVID, the teens have starved the social interactions, have been affected by screen and this isolation and increased screen time while decreased academic.
They see they want to interact with their families less. Something is just different, not in a good positive way. And so
there's no rebound. We have to post-COVID, as things open up, we need to see a rebound. If they're not seeing a rebound and things are not returning to normal, there may be an underlying issue.
Yeah, absolutely.
Yeah, definitely.
So if something changes, behaviorally, kind of like, socially in a negative way, that's a good way to kind of gauge someone's well-being.
Yeah, that's a good way to put it, a socially negative way.
Mm-hmm.
Yeah, and I think for a lot of younger people too is depression, but also a lot of anxiety too. That
Absolutely.
That too. So that's good to hear that you have treatments for that as well.
Absolutely. Yeah.
And what would be the best way for patients to get in contact with you if they're local to you guys and interested in coming in?
Yeah, we're very receptive to new people.
Yeah, so we actually offer in-person and
telepsych appointments.
Telehealth services. So literally people can, enter a virtual waiting room. The residents of the state of California legally can get treatment via telehealth, and they can register online by going to our website www.lgtcgroup.com, and they can request an appointment as a new client. If they can, they have the insurance, they could just register, and we'll get back to them within a day, and we'll get them an appointment. They'll get an evaluation by a therapist, and then they'll get routed to a proper treatment team.
But to answer your question, so it's online, right? I mean, they can just give us a call.
They can call us. So our website has all the information. Most people will still register because that's how we check the benefits.
Yeah.
But the best way is to register, but they can also call.
So just looking up Los Gatos Therapy Center would be the best way to kind of start.
Mm-hmm. Going to the website, registering.
Mm-hmm.
Perfect. Yeah.
So we're open to people who need help, essentially.
Definitely, that's good to hear. And those are the questions that I had for you. Was there any last advice or anything you wanted to leave patients with if they're just struggling with their mental health and not sure what to do?
Again, I'll circle back to the original to one of the first questions you've asked. Just ask for help. I mean, we're here for people, and we're we'll do everything possible to help them.
I think that there are a lot of undiagnosed issues. It doesn't hurt to get assessed.
Absolutely.
And so if something is amiss, especially for parents that see, but also for adults, the partners, you see something is not right, you see the person is acting differently, more withdrawn, more less social, usual activities that not resuming. If somebody used to play golf, for example, doesn't play golf anymore. Those are all the signs of various stages, I guess, of some kind of mental health concern, right?
It does not hurt or cost much to just get an assessment.
Right.
And get an opinion of a professional and see, you know, you just never know. Your life might get better as a result of just one step like that.
Yeah, absolutely. And there's certainly no shame in it either. I mean,
Absolutely.
if somebody, you know, needs to check up their physical health, or especially, you know, if somebody, you know, breaks their arm, they're not sitting there waiting and just saying, oh,
That's right.
better.
That's right. And you know, the reality is that, you know, research is showing, more and more research is pointing to the fact that it's all a lot of it is biological in nature. So it's medical, if you want. I mean, people separate it, but at the end of the day, it's medical.
And the people, when they break their arm, they see it hurts, the arm is broken, but like the emotional pain, sometimes it's not easily identifiable, and it's not easily, but it does hurt a lot, and so and it's fully confidential. So it's not like some people say, well, will my employer find out? No, we don't release records. It's fully confidential. We don't release records to anybody. There's a very special federal rules about how mental health is separate from any other record and how it's treated and how it's handled. So I don't advise anyone to worry about not seeking treatment because, well, my employer might find out.
We take that very seriously.
Yeah,
there's no chance of that happening.
It's just untrue. It's not available. It's not true. I mean, you know, I guess if you're like a police officer, right, maybe that is something of a concern, right? But unless you're in those
general,
general public,
your information is safe.
they need to know that no, we will never share it with an employer. No, we likely not to even be able to release the records to the patient themselves, if you know, unless for any specific reason. So it's very confidential, and there's no harm in just taking a look at it, I would say.
So if you feel like your life is not going as well as it used to, right? It's a good idea to reach out and get help, essentially.
Definitely. Yeah, and I can tell you guys have worked very hard to create a very welcoming and caring environment there. So I really love the work that you guys are doing there.
Thank you so much. Appreciate it.
Absolutely. All right, well, thank you so much for taking the time to talk with us today and share the education. I really appreciate it.
Well, thank you for having us.
Mm-hmm.
Absolutely. All right, well, have a great rest of your day, guys. Thank you.
All right. Thank you so much.